A new study published in the Journal of the American Medical Association is shedding light on how having a black doctor positively affects black patients' health. The study found a 10% increase in the number of black primary care providers was associated with a roughly 30-day increase in life expectancy for black individuals. Higher black representation among doctors was also associated with a reduction in mortality rates among black people and reductions in black-white mortality disparities. Joining us now is Dr. Kameelah Phillips. She is a board-certified OBGYN and an advocate for women's health care issues. Dr. Phillips, as a practicing physician, what are these findings? How do they read to you? How do they fit with your real-world lived experience?
Actually, quite consistent experience. I find that when patients see themselves in me, they're more likely to be compliant, to engage in the medical establishment and have better outcomes. So this is pretty consistent with what I see.
The study tracked 1,600 U.S. counties. More than half of the U.S. counties couldn't be used in the study because they don't have a single black primary care physician. So what does that tell you about the health of the healthcare system in America?
Well, it tells me we have a long way to go. It tells me that our health care system does not reflect the diversity of our nation. Approximately 5.7% of doctors are African American, while we represent approximately 12% of the population. And so that means to me that we need to put more doctors in the pipeline so that we can serve our community, not only the African American community, but other communities as well.
Do you think these data, Doctor, will change or help make the case for including increasing those numbers of doctors?
I really hope so. I would expect that it would. Every industry, and that's medicine included, benefits from diversity. And this is the first study that shows an increase in life expectancy, but we have other studies that give us good data suggesting that Black doctors are really key in the community to improve compliance, to improve access, provide culturally responsive care, and thereby decreasing health disparities. So this is something that we really need to focus on in medicine because our diversity issue will not go away without more Black doctors.
And is there also a way or a second piece or is this useful in community health centers or something that in the interim, while more Black doctors are being trained and brought into the community, that can be done to create a bridge? Because now these data are out there and there is this issue about care.
I think there is something that can be done. I think that in healthcare institutions, we need to really address issues of race and racism, as well as medical bias. Even though we have these large institutions, we have to recognize that they're made of people who bring their bias and racism into the relationship. And this really can change the lives and trajectory of entire communities. So I think it's important that we start having conversations about race, healthcare disparities, and not only that, implement serious anti-racism training for everyone involved in medicine.
Our colleague, Dr. John LaPuca, has started something at NYU Langone called the Empathy Project, which tries to get at those implicit biases. Is this something that you think should be just a standard part of medical training or advanced training, even if you've already been through med school, to understand the contours of these different biases because A, they exist, and B, there's now medical proof that it harms care?
I do think so. And I think it actually should begin the first day of medical school. By the time you start medical school, you're on average in your early 20s. And so if you come in with biases, you've had them for about 2 decades. And so it's going to take time to help you acknowledge them and really work to dismantle them. So this is something that should be instituted in every curriculum and carried out and through your entire training.
Dr. Kameelah Phillips, thank you so much for being with us.
Thank you for your time.